Hello, I'm gonna try to use this new app to explain some things on the evidence-based practice assignment. I've pulled up a study here, and it's called a randomized control trial. A randomized control trial. Comparing two instructional approaches to home exercise instruction following arthroscopic full-thickness rotator cuff repair. So the first thing I want to talk about is the randomized control trial. That is the type of trial, the type of research design, and it is one of the higher levels of research. This meaning that there is a control group in which one of the research groups does not receive any sort of intervention. And so that's, I think, a 1B on the hierarchy scale. The only thing that's higher than that would be a systemic review in which multiple randomized control trials are compared. And then we have I want to discuss the independent and the dependent variables. The independent variable is the independent variable in this case is the two instructional approaches to home exercise. That is the independent variable. The deep, and this would be the relative cause. The effect is a little bit tricky in this one, but the dependent variable is what is being measured. And so really, they're measuring things that are happening after the arthroscopic rotator cuff repair surgery, things like shoulder function and pain, and we can see that a little bit later on in the study. And then this particular study was done by JOSPT, or it was published in that journal. Here are the authors, so you have all of their names listed there, and that will be important whenever you go to cite your source. And so we can come on down and look at some of the items here. Once again, it was a unblinded, randomized clinical trial, so that meant that the two, whatever the groups were, they were not blind to which group that they were in. It was unblinded. Here we have the objectives, or also called, this would be the purpose of the study, to compare the effectiveness of two types of home program instruction, video tapes or recordings versus personal instruction by a physical therapist. And then they looked again at the subjective outcomes and exercise compliance. That's actually what the dependent variable is. And so they talk about their methods here. And this is important. Patients who consented. So that would be your ethical considerations. It's required that the patients understand what it is that they're participating in and the benefits or the risks of the study, which this would have a low risk, but if you're thinking of drug trials or anything of that kind, that where there could be some potential risk for them to become injured or worse, because it's a study, so we're trying to figure that out. So I wanted to mention that, so that would be the ethical consideration, that the patients consented. And then here we have the shoulder pain and disability index and the shoulder scale scores. These are the outcome measures that were used. So in the beginning of the study, they would have asked the patients to rate their disability, and the shoulder scale score, I'm not quite sure what that one is, but it's an outcome scale. And so this would have been done at the beginning of the study and at the end of the study, and then the scores would be compared to see if the intervention had caused a change. So that's how we would know if things had gotten better. Okay, and then here we have the MANOVA. These are statistical measures, and so I don't really want you to worry about those very much at all, just that people who are very, very smart analyze the numbers and the statistics to see if there was any sort of significant change from what one group got to what the other group got. And so here you see the conclusions, and this would be an abstract actually. When you're looking for your articles, you will want to search for full text articles so you can get all the pieces that you need for your assignment. But I thought this was kind of interesting, so I wanted to point it out, the conclusions. Patients who utilized the videotape method for their home program had self-reported outcomes equal to patients instructed in their home program personally by a physical therapist. And self-reported compliance with the rehab program had little effect on the outcome. So that's kind of surprising, that what that means is we can do the same type of training with not much difference, at least according to this study, whether we videotape it or we are, sitting right there in the clinic with the patient. So this is one study, and you can't make complete conclusions off of one study, but it was an interesting finding. And then here is the reference. This is from the Journal of Orthopedic Sports Physical Therapy, 2002. So I'm going to stop there and go to the next page. So here was the next page of the study, and I'm not going to read all of this to you, but it talks about, how the patient education was done up here with the home exercise program. It talks again, here is the primary purpose, and they were just looking at the two different approaches, one with videotape instruction and then one with the instruction performed by the physical therapist. And once again, we see the outcome measures, what is being used to determine if there's change, the shoulder pain and disability index, and then the self-report. Here we go through the subjects, and it talks about who was included in the study. It's a little bit difficult to see, but sorry, my pen's kind of going crazy here. Subjects diagnosed with full thickness rotator cuff injury, and this was confirmed on an MRI, so a magnetic resonance image confirmed that they did indeed have a tear, and they were willing to undergo arthroscopic repair. And so these would have been people that were included in the study, so the inclusion group. Now, the the exclusion group, sorry, the page is cutting me off down here, but those who were excluded from the study were patients with rheumatoid arthritis and patients who had previously undergone a shoulder surgery. So those were the people that the researchers did not want left in the study. And so you have to look at that, because the people who were included in the study, these are the people that if you have patients that are similar to, then you can extrapolate these findings to draw an assumption that a similar technique or intervention would work with them. And so what this is saying is, the findings related to the study we could only extrapolate out to what was included in the inclusion group. So the findings of the study would not be pertinent, perhaps, to people with rheumatoid arthritis who had undergone previous surgery. And you see the SPADI again, which is the shoulder index that we're going to use to determine whether patients are getting better. The next page just talks about the procedures, and these are, again, I'm not going to read through this, but this will show you exactly what happened during the research study. So it looks like they were scheduled, then they had their surgery, and then they had a sling for 6 weeks, and then they received one standard physical therapy treatment at bedside, and so on. And they were asked to log how compliant they were with their exercises. And then the study, it looks like, went on for 6 months. So this just gives you a little bit more detail about the group, or what they actually did. Then down here, we see that the exercises included passive exercise, active, and strengthening. So very typical types of interventions that we would use in therapy, because this is a physical therapy study. The next page just goes through how the different groups were divided, and sort of the schedule. Nothing too exciting there, so I'm going to go on to the next page. Okay, the next page has a little bit more meat in it. Here is the data analysis, and once again, for our purposes, we're not going to look at specifically how the statistics were ran, but you see the MANOVA here being mentioned, and the statistical analysis. So those would be your PhD people who would probably be doing that part of it. The subjects, there were 64 participants in each group for a total of 128. And so not a big study, that's not very many people. The higher the number of subjects in the study, the more valid the findings are. So 129 really is not that many. But then it will once again go through more detail about what they did. Okay, I fast forwarded to a few pages, but on a page like this, you're going to see the statistics, and you're going to see the two groups being compared. and that's what you're seeing on these charts. So whenever you're reading a research study, you're always going to find these things. Over here we have all of that statistical stuff. And honestly, I've had a class over research methods and had to learn all of these, but they're very, very complicated, and I don't know that I completely understand them. But if you went on to get your PhD, you would be learning how to run all of these statistical analysis. And then the last page we have here is usually my favorite page. I always go for the conclusions because, hey, I can understand those and they're kind of easy to follow, but there's a little bit more before we get to the conclusion about the independent variables and how things were laid out in a little bit more detail of the study. But the conclusion, based on two self-reported functional measures, the Spady and the UPenn shoulder scale, the results of this current study suggest that videotapes can be an important patient education and instruction tool utilized during rehab. They found no differences overall in the self-reported outcomes of function during that first year following surgery between the patients being instructed via videotape or with the therapist directly educating them. So I thought this was kind of an interesting study just because we're into all this online stuff right now, and it's just kind of interesting. So you'll probably see more and more telehealth sorts of things emerging. And again, it's a relatively small study. It's not as though these findings are absolutely conclusive. But and then the very last thing I wanted to mention was how to cite your source. And this is kind of an easy one to follow, but what you're going to do first is to list the authors' names. So Sashika, I'm not sure how to say these other names. And then you'll notice that there is a period after that. And then the name of the study. So Home Program of Physical Therapy, Effect on Disabilities of Patients with Total Arthroplasty, period. And then, yes, what you're seeing here is right. These are abbreviations for the journal, and they should be italicized. So Arch Phys Med Rehabil, I think that means Archives of Physical Medicine and Rehabilitation. That's the name of the journal. So if you're looking at the Journal of Physical Therapy, it'll just say Phys Ther, but it should be italicized, and then a period, and then the year. So we have 1996, semicolon, and then the volume 77, colon, and then the page numbers. And so when you're citing your source on this assignment, this is how you should cite your source. If you go on to physical therapy school, this is how you will be doing it, and you can get counted off on your papers if you miss, that there's a colon here or a period there. So this is called the AMA style, and this is how I would like you to cite your sources really throughout the program. That's how you should do it. Okay, I think I'm done. I'm going to try to save this, and I hope that helps you with your evidence-based practice assignment.